Hi everybody, my name is Ishita and today I'll be presenting my paper that used wearable device and patient-reported outcome to evaluate the influence of sleep on quality of life among breast and prostate cancer patients. It has been reported that large numbers of breast and prostate cancer patients experience both physical and psychological side effects, even years after treatment. Sleep quality is one of the major aspects that influences the quality of life of cancer patients. Now, what is quality of life? Quality of life is basically the state of well-being that is made of two components: the ability to perform everyday activities that reflect physical, psychological, and social well-being, and patient's satisfaction with levels of functioning and control of the disease. Hence, with regards to cancer, due to the deteriorating existence and treatment of the disease, quality of life has become an important outcome indicator for cancer patient management and care. Currently, there are two data analysis methods for measuring sleep quality: objective measures such as actigraphy and subjective measures such as questionnaires. In our study, we used actigraphy and two questionnaires. Let's come to methodology. In our study, we had 40 participants recruited from two cancer centers in Taipei, Taiwan from April to June 2018. Only 31 patients' data were usable due to technical malfunction in 9 of the devices. This study included 16 breast cancer and 15 prostate cancer patients. For the inclusion criteria for our study, the patients needed to be more than or equal to 20 years of age, should have been diagnosed with either breast or prostate cancer, should have been receiving evaluation, treatment, or follow-up care at Wanfang Hospital or Taipei Medical University Hospital at the time of enrollment. Should understand Mandarin Chinese because that's the language spoken here. And lastly, they should give informed consent to participate in the study. Patients were excluded if they could not understand the intent of the study, or clinician believed that the patient was not fit to participate. There were two tests that were done: the Berg Balance Scale test, which was done to ensure balance abilities, and Mandarin Chinese version of the Mini Mental State Evaluation, which was conducted to ensure the normality of cognitive levels. For data collection, the objective data was collected using actigraphy device and subjective data was collected using questionnaires. Participants were asked to fill the Chinese version of EORTC and PSQI questionnaire at the end of 7 days. EORTC stands for European Organization for Cancer Research and Treatment, and PSQI stands for Pittsburgh Sleep Quality Index. The patients were asked to wear the wearable actigraphy device continuously during day and night, time for a period of 7 days. Such devices monitor continuous movements and have been used to determine disruptions in sleep-wake cycles and has been validated among cancer patients. The sleep-wake detection method in this study was based on an algorithm presented by a group of researchers led by Gorney. For reference, anyone can go and read my paper. Detailed explanation on this method is given in a previous study done by my colleague in my department. My colleague assessed sleep quality among breast and prostate cancer patients and did a comparison between subjective and objective measurements. The paper was recently published in June in journal Healthcare. On the other hand, our study focuses on influence of sleep on quality of life among breast and prostate cancer patients. Okay, coming back to actigraphy device. The actigraphy was designed in Taiwan itself by KNY Labs based in Taipei. This was previously being used by a group of researchers at Yangming University Hospital and Taipei City Hospital. The actigraphy device is a compact unit. It has a lithium-ion battery of 80 mAh capacity that can last up to 14 days. It is worn on non-dormant wrist of the user and collects data that is sent via Bluetooth to a mobile device application. These data are then uploaded to the cloud and stored there where they can be accessed for evaluation. Every second it gathers 3-dimensional data and transforms it into 10-second movement statistics. Milligravity, angle, and spin variations are the measurements from the actigraphy device. For the ethical approval of this study, it was obtained from Taipei Medical University, Joint Institutional Review Board. In order to differentiate between poor and good sleepers, median of total sleep efficiency was decided as the cutoff, where greater than or equal the median among all participants was described as poor sleepers. We know that total sleeping time is basically the total amount of time that the patient was asleep. So sleep efficiency was total sleeping time divided by the total time spent in bed. In order to differentiate between long and short sleeper, median of total sleeping time was considered as a cutoff, where greater than or equal than median of sleeping hours among all participants was described as long sleepers. We decided to use median as a cutoff because it is considered as a good method to determine an optimal cutoff points, as it was done in previous research as well. Pittsburgh Sleep Quality Index is a 19-item self-reported questionnaire that has 7 subscales, including sleep quality, sleep latency, sleep duration, sleep efficiency, sleep disturbance, sleep-asleep medication use, and sleep dysfunction. For scoring of each individual components of 19 items, the range observed were from 0 to 3. The 7 component results are then accumulated to give a global sleep quality score between 0 and 21, and higher score would imply worse sleep quality. This questionnaire distinguishes between poor sleepers from good sleepers, wherein if the global PSQI score is more than or equal to 5, then they are considered poor sleepers, but if the score is less than 5, then they are believed to be good sleepers. This global PSQI cutoff score has discriminated good and poor sleepers in cancer survivors earlier by researchers, and thus was used in our study. On the other hand, European Organization for Cancer Research and Treatment has 9 multi-item scales, 5 functional scales that included physical, role cognitive, emotional, and social, 3 symptom scales that included fatigue, pain, nausea, and vomiting, and a global health and quality of life scale. Additional symptoms commonly reported by cancer patients such as dyspnea, loss of appetite, insomnia, constipation, and diarrhea, and perceived financial impact of the disease are also assessed using single items. Each of the scales and single item measurements vary in value from 0 to 100. A high score for a functional scale signifies a high or healthy level of functioning. A high score for a global health status quality of life signifies a high quality of life. But a high score for a symptom scale item signifies a high level of symptomatology or some sort of problem. In our study, for statistical analysis, the software used was SPSS. The data was analyzed using t-test. Imputation was used if there were any missing data, and the significance level was at p less than 0.5, two-sided. Finally, the results. This figure demonstrates the proportion of different age groups based on sleep quality and sleep duration using PSQI questionnaire among breast and prostate cancer patients. The part which is light blue colored signifies those patients that were up to 50 years of age. The orange color denotes the age group between 50 and 59. Gray depicts the age range between 60 and 69. Meanwhile, yellow color tells us about those number of patients that were aged between 70 and 79. Dark blue color signifies the age group from 80 to 89. And finally, the green color tells us about those patients that were from 90 to 99 years of age. This table gives us influence of quality of life subscales in good and poor sleepers among breast and prostate cancer patients. For breast cancer patients, the p-values were significant for global health, emotional functioning, dyspnea, constipation, financial difficulties, for sleep quality assessed by using PSQI questionnaire. While constipation was found to be significant using both PSQI and Actigraphy measures. Both measurements indicated statistical significance for constipation among breast cancer patients with good sleep in comparison to poor sleepers. For prostate cancer patients, the p-values were significant for constipation assessed by using PSQI questionnaires, while nausea and vomiting, appetite loss, and diarrhea were found to be significant by using Actigraphy. The Actigraphy analysis indicated that prostate cancer patients with even good sleep experienced more symptoms or poor quality of life in certain components of quality of life in comparison to poor sleepers. This table gives us influence of quality of life subscales in long sleepers and short sleepers among breast and prostate cancer patients. For breast cancer patients, the p-values were significant for nausea and vomiting, constipation, and diarrhea assessed by PSQI questionnaire, while emotional functioning, dyspnea, appetite loss, diarrhea, and financial difficulties were found to be significant by using Actigraphy. Both PSQI questionnaire and Actigraphy indicated that short sleepers experienced more symptoms or poor quality of life in certain components of health-related quality of life in comparison to poor sleepers. For prostate cancer patients, the p-values were significant for nausea and vomiting, insomnia, constipation, and diarrhea assessed by using PSQI questionnaire. While nausea and vomiting, appetite loss, diarrhea, and financial difficulties were significant by using actigraphy. Components of quality of life such as nausea and vomiting, diarrhea were found to be significant using both PSQI and actigraphy measures. In our research, sleep quality and duration measured using actigraphy device were found to have more influence on the symptoms or subscales of quality of life. Not all of these had an influence on quality of life when subjectively measured using PSQI. PSQI measured sleep quality showed an influence on the quality of life subscales, including global health status, emotional functioning, dyspnea, constipation, and financial difficulties among breast cancer patients. This is in contrast to a study where sleep problems were found to be associated with all dimensions of quality of life. For reference, you can read the paper. Actigraphy measured sleep duration showed that breast cancer patients who were short sleepers significantly suffered from physical symptoms like breathing discomfort, that's called dyspnea, diarrhea, appetite loss, as well as emotional functioning. This was similar to a study by Liu and his colleagues that showed significant relationship between low physical health related quality of life and poor objective sleep in patients with shorter sleep duration. For prostate cancer patients, the sleep quality measured using actigraphy device reported an influence on nausea and vomiting, appetite loss, and diarrhea, while PSQI measurements determined the influence only for constipation. Sleep duration, as measured by the actigraphy device, influenced nausea, vomiting, appetite loss, diarrhea, and financial difficulties. On the other hand, PSQI measured showed an influence of sleep duration for quality of life subscales of nausea and vomiting, insomnia, constipation, and diarrhea. Overall, good sleepers and long sleepers assessed using actigraphy showed poorer quality of life for prostate cancer patients. After seeing the results, we feel it is quite possible that prostate cancer survivors were still at risk of experiencing insomnia symptoms prior to treatment, or must be that they had sleeping issues before their diagnosis. According to one study, half of the prostate cancer survivors who met the requirements for chronic insomnia syndrome had sleep problems before their cancer diagnosis. After performing the study, we felt that PSQI could be a better measure for sleep quality, while actigraphy device could be a better measure for sleep duration while relating to the quality of life subscales. For prostate cancer, actigraphy measures were more useful to relate sleep quality to quality of life, while combined measures were useful when relating sleep duration with quality of life. Thus, our study suggests that both subjective and objective measures are useful to determine the influence of sleep on quality of life of cancer patients. The strengths of the current study include objective as well as subjective measurements of sleep among cancer patients. There have been few research in the past that assess the influence of quality of life domains in sleep quality and sleep duration among prostate cancer patients. In addition, there has been limited so far study on quality of sleep in prostate cancer in Taiwan itself. Although our study had interesting findings, there were some limitations. First of all, the low number of participants increased the possibility of missing data. Then some devices malfunctioned, which further led to incoherent data. Also, the device was used for a shorter duration. A longer duration could have ensured efficient data collection and improvement in the observed results. Lastly, if a participant who was awake but not moving could have been wrongly detected as sleeping by the actigraphy device. We hope that in future studies, we could have larger number of participants for longer duration. To sum it all up, our study indicates the influence of sleep duration and quality on quality of life. As sleep disruption is prevalent among breast and prostate cancer patients, early evaluation and tailored intervention to improve sleep quality becomes necessary for better quality of life. Thank you.